But right now, I mean, given that most people, and I think Stephen alluded to this earlier on when he was sort of talking about the macroeconomic conditions that everybody's facing, I think there are some significant headwinds that probably we're going to see in the next couple of years. And certainly given the amount of pandemic funding and other things, a lot of governments are pretty much struggling with budgets and other things. I mean, for a start, the Strengthening Medicare Task Force has got, my understanding, is $750 million to work with. Is that enough? I mean, what are we talking about in terms? Will it even touch the sides?
And that's over 3 years, Marcus.
Yeah, that's right. So what are we talking about in terms of quantums of funding to actually make Medicare more universally accessible then?
So I think it partly, I mean, my view is the 250 million is not enough to fix everything, but I don't think it's ever been sold as enough to fix everything. It's in a sense, a down payment. If you recall, the Labor Party went into this year's election with a, inverted commas, small target strategy. It went into the 2019 election with big spending and big taxing proposals and was monstered. And so they decided, we're not going to propose big, we're going to propose small, which is what they did. And so they didn't say, we're going to fix everything with the money we put on the table, because that's what the public voted against in 2019. The public voted against a universal dental scheme. The public voted against a massive expansion. And so, we've got to actually remember there's a political context to this. And the context is a government that went in with a small target strategy and not saying it's going to fix everything.
And noting that, and Albanese seems to be a man of his word who wants to honour all his election commitments and pledges. But from the point of view of the Australian Patients Association, we've been a strong advocate to include dental care in Medicare. It's unfortunate Gough Whitlam couldn't convince the dentists 50 years ago, but unfortunately they didn't come to the table then. And it's going to be a tough ask, but we get so many complaints about the cost of dental care here. We really need, the Australian Dental Association really needs to start talking to patient groups. I know with the super clinics it will cover dentists, and some of the state governments have got schemes to help needy people and school children with dental care, but too many Australians don't have a regular dentist. Too many Australians don't look after their oral care. And as a result, they have ill health and end up in hospital, and it indirectly costs us, even though there's a big time lag. Now, I know the government can't afford to do this now, but I think as an ultimate aim, I'd love to see dental care as part of Medicare.
So, Stephen, I think the ADA has moved a long way in the past, and I think they now support some sort of universal dental program, and you won't find a stronger support for universal dental program than me. However, the government did not go into the election with that on its agenda, and I don't think, my own view is I'm not going to advocate for it to be done this term. I'm certainly going to advocate for it to be on the agenda for the next election, but I think we've got to honour what the government, the commitment and the contract, in my view, between the government and the people from the 2022 election.
No, I agree with you that this is a longer term aim, not in the next 2 years, but probably 5 to 10.
And it's also a great opportunity to learn from some of the work that's being done in the public dental health space around shifting the way we think about dental care, that it's not just about what's provided by a dentist, but the dental hygienists, the oral therapists, even the educators who can support some of the preventive work around in oral health that doesn't have to be delivered by a dentist. So again, it's about how do we use our workforce, effectively to improve the outcomes. And then again, how do we design the governance mechanisms and the reporting and the data and the funding so that it actually supports improved outcomes.
And with dental, we've got an opportunity to start differently from the way we started with Medicare. I wouldn't start with a fee-for-service, uncapped, unregulated fee-for-service system. I'd start in a different place.
Yeah, and I think that's the issue, isn't it? Is that if we all had a clean slate, knowing what we know now, it'd be much easier to create the ideal system. But right now, the change management of something that's been in place for as many years as it has been, it's not the easiest thing in the world.